on this computer. Hello, thank you for joining me today and allowing me to interview you for class. You can choose to talk about whatever you'd like that stems from the questions I ask. This will be shared with my professor and possibly my classmates, so please keep language as appropriate as possible. Could you please introduce yourself?
Hi, I'm Jade Ricketts. I am Erica's sister, and I have BPD.
Awesome. What all do you know about your BPD?
Um, I know that I know quite a bit about it, but it is mostly like learned characteristics over time, a extreme fear of abandonment, and so many things that I don't even know where to start.
Um, do you know anyone else who has BPD?
Um, I have suspicions of people based on the way they react to some things, to their triggers, and how I would react to one of my triggers fairly aligns to. So like there are some people in my life or that have been in my life previously who I'm almost certain have BPD, either diagnosed or undiagnosed, but I never asked.
How did you get diagnosed with BPD?
Um, Well, I went to the doctor because I was having trouble concentrating, and she kind of went through my whole life history and my family's medical background and all of that stuff. And based on the information I told her, she said that, it was likely I had BPD. She recommended a book for me to read. I read the book. I told her I didn't think it was me, and then I realized that it was exactly me.
Did you have to do like any type of like um formative like assessment with someone or like get testing done in any way?
I didn't get testing done. It's more, BPD is more like a bunch of negative traits that you develop over time, but they're all learned. So there isn't really a medical treatment for it. And diagnosing someone with BPD can actually worsen their path because it gives them an excuse or an out. Not in like a, oh, they're just lying, whatever. It's the feelings are there, everything is true, but they don't realize that what they're doing, you know
Do
so
you feel like BPD, do you like use BPD as an out for things?
I am in therapy, so I definitely do not, but I used to like, oh, I was late to work today because this and this, and in reality what really made me late to work is that I didn't get up early enough to accomplish all of the tasks I wanted to do, and therefore could have avoided the chaotic breakdown that proceed or followed it.
What
You
kind of
know,
therapy do you do
does that
to
make
help your
sense?
BPD?
Dialectical behavior therapy is the best way to treat, uh, according to research, I think. Um, and it has literally changed my life. I've been in there. It takes a long time. And the worst part about BPD is that it is never ending. It is something you will always deal with, but you learn how to deal with your emotions because instead of looking at everything on an emotional level, you break it down into what is factual, and you analyze the situation and determine if it's worth it. But before I got to this point where I was able to really directly use these tools, I had to learn how to calm myself down first. So we worked on learning emotion regulation through meditation and mindfulness practices, and being aware of what we do, because a lot of people with BPD don't realize that they're hurting people or that they are gaslighting. That's something that somebody can do if they are offended and you're not giving them validation, because people with BPD need validation. um, and that in itself is a huge trigger, and it triggers me in every area of my life. It'll trigger me at the grocery store, it'll trigger me on the phone with my boyfriend, it'll trigger me at home. But what I've learned the most is that uh, they're learned behaviors, so all you have to do is try to fix it. And my therapist always says how get the you don't eat your you don't eat by the plateful, you eat one bite at a time. Like, it didn't, like, all of these issues didn't happen overnight, so I can't expect an overnight cure.
So you said that like having BPD is difficult for you because of like emotions. Is there anything else that makes having BPD difficult for you?
um the emotions are really out of control sometimes, not so much anymore. I've been in therapy since September, and I am making serious changes in my life, and I feel really good about them. But BPD, the triggers, there's so many things that trigger me. And the impulsiveness, I have so much trouble not spending money and not eating that whole bag of candy. I don't know how to stop at just one. Um, and then I don't know how to calm myself down about the fact that I didn't do what I was supposed to do. I'm sorry. What was the question?
No,
What
you're good.
else was hard?
That was good.
Um, Other things that are hard is trying to communicate with people, because I'm so scared that others will abandon me that I don't want to talk to them about what is upsetting me, because I don't want to give them a reason to leave. And that is a problem I deal with even today. It's hard for me to talk to my roommate about leaving dirty dishes in the sink. Like, it's hard for me to really have any sort of discomfort. If I'm uncomfy at all, it's difficult. And it doesn't get better until you learn how to regulate your emotions. And I'm learning, but it's a slow process.
Do you think there's anything else people should know about BPD or like dealing with people who have BPD?
It is kind of stereotypical that borderline personality disorder means you are narcissistic, and uh, that you're kind of like toxic and people don't want to be around you. And I think we really need to break that stigma, because we literally are this way because we're scared of being abandoned, because we need validation, we need to know we are loved, and we need it to be in specific steps. Like, you can't give me an apology with one part of, an apology is three parts. you know, the I'm sorry part, why you're sorry, and what you're going to do to fix it. You can say all of those three things separately, and it won't matter to me until you say them together, because otherwise it feels like you're invalidating me somewhere. And I need the validation, but I'm not trying to be a toxic person, and I'm not trying to gaslight you. I'm not trying to make you feel belittled. We're not trying. We just literally feel so strongly about it, and it affects, like, I'm not saying validation affects everybody or that abandonment affects everybody, but it's characterized by those things. And every book out there that I have looked at talks about how to leave a borderline personality disorder person. And what you really need to do is learn how to communicate with them. Because if they can understand their triggers and work through them and teach you how to help them with their triggers, then the problem is going away, because the problem isn't the person with BPD, it's the feelings that an event caused. The feelings are the problem. If you want to fix the feelings, you have to go back to the source, which is the trigger. And like setting out to leave the person with BPD, or assuming that they're going to be difficult or hard to love, that creates an attribution bias, and you actually can end up treating them differently because of that bias, and it's unconscious. And it's really, that's the most disappointing thing to me when I understood that my diagnosis was my own and I started doing research. I was looking for a bunch of books. I ended up finding this one by the person who invented dialectical behavior therapy, but all of the other books I've looked at are about how to leave the narcissistic borderline, and we're not all narcissistic, and the ones that are like that because that's what they were raised, you know, they learned that stuff. If they don't want to get help, that's their own problem. But for the ones of us really trying to get better, it's not fair that the stigma is attached to our name or our diagnosis, or that the diagnosis is something that defines us.
Is there anything else you want to add?
We cry a lot. I don't know. I cry a lot. I cry so much. But meditation and my therapy is really changing my life. DBT comes with like a workbook, and it helps you actually trace back from the event. Like, let's say I just went out and spent $100 and now I don't have money for rent. That's never happened to me because I always have money for rent. But let's say it did. I would have to go write down that I spent $100 recklessly. And then I would have to go back to what happened before that made me feel the need to spend that money. Because the impulse to buy something arises only when this, and this happen. You know, I'm buying things because I am sad, or I don't feel good, or whatever. And it helps you just come back to the root, understand that the problem is just that, it's a problem. We can fix it. Our emotions are the only thing we have control over, or our behaviors are the only thing we can control. We can't control what makes us sad. We can't control what makes us happy, but we can control how we react to that feeling. I used to be a yelly person. I still am sometimes, but I went from having panic attacks almost every day to having them once a week or once every couple weeks. I can't even begin to explain how much it has really changed my life, to know my diagnosis and know how to treat it. Because a lot of people with BPD say, oh, well, I've got BPD, there's no cure, so I might as well just give up, you know, I'm going to be like this forever. But that's not the case. You can go to therapy, and while therapy may be stigmatized, it can change your life. Like, a therapy invented it, like, that is literally for helping you learn how to cope with these dysregulated emotions and thoughts and biases that we hold because of things we learned growing up, or because of trauma, or because of whatever else. You know, there's many different pathways to BPD, but I think it's important that people know it's not a death sentence. You know, it's not a, oh, I'll never get better, because it's only been how many months, and I feel like a whole different person. I'm happier. I'm not tense all the time. I still cry, but not near as often. I used to cry literally every second of every day. I have no suicidal thoughts or actions, most of the time. Sometimes they still sneak in, but overall, my life is improving in big strides. But in the moment, you don't see the change. So, like, if you have BPD and you want to get help, don't give up. Don't give up. That's my biggest advice.
Okay. Thank you.
That was a lot. Sorry, I talked.